As many of you are already aware, healthcare today is actually sick care. We only have 2 to 3 doctors for every 1,000 people in the US. So most of doctors' time is spent treating people who are already ill rather than helping prevent people from becoming ill in the first place. And there's vast quantities of data that isn't being fully utilized. This includes both imaging data, EHR data, and genetics data. And there's a lot of valuable insights waiting to be gleaned from this data, but most clinicians don't have time to carefully analyze all this data and then develop preventative healthcare plans for their patients. So this is where I think AI can bring the most value, not by replacing doctors, but by filling all of these gaps in our healthcare system. This may sound a bit crazy, but there's a lot of good research suggesting that 90% of heart disease is preventable. Autopsy studies show that 15% of 15 to 34-year-olds have fatty plaque deposits in their arteries, which is the earliest stage of the progression of atherosclerosis. If we can identify these people early enough, even in their childhood years, and then target them with interventions such as drugs and gene therapy, then we could prevent 90% of heart disease, which is the leading killer in the United States. When I was at the National Institutes of Health, I worked on a number of automated tools which can do measurements in any CT scan, both non-contrast scans and contrast-enhanced CT. These are sorts of measurements that are not done today just because they're time-consuming to do manually. But using these automated AI tools, we can measure things like bone mineral density, how much plaque you have in your aorta and your heart, how much visceral and subcutaneous fat you have, muscle volume and muscle density, liver volume and liver fat, and many other things as well. So for each of these measurements, we can compare a person's measurement with others in their age and gender cohort, and then we can do risk prediction and personalized health recommendation. This is just showing measurement of plaque in the aorta. So using this sort of measurement, we can predict cardiovascular disease risk in 2 years, 5 years, 10 years, or 20 years. And the level of risk prediction that we get is almost as good as a specialized cardiac CT scan. This is showing fracture risk prediction. This was a patient who had a number of CT scans for colorectal cancer screening, and it was observed that her bone mineral density was decreasing over time. So using this automated measurement of bone mineral density in the vertebra combined with a measurement of muscle density in the spinous muscle, we can predict how likely someone is to get a fracture. In this case, this person had a hip fracture about 3 months after this final CT scan was taken. We can also do diabetes risk prediction by looking at certain biomarkers in the pancreas. This is honestly not super accurate, but this was the first time this had ever been done. And then another thing that's very low-hanging fruit is identifying fatty liver disease. Some work we did at the NIH showed that 70% of mild fatty liver is missed by radiologists. But this is one of the easiest things for AI to do because the liver is actually one of the easiest organs to segment. There are dozens of other examples in a similar vein. There's been excellent work from Regina Barzolet's lab at MIT on breast cancer risk prediction. There's been work from Calico Life Sciences on using DEXA scans for cardiovascular disease risk prediction. Currently, DEXA scans are commonly performed to measure bone mineral density, but you can also measure the amount of plaque in your aorta, which is something that's currently not being done. And then we can also use AI to identify early stage Alzheimer's disease. A few years ago, people thought that this was going to be impossible just from structural MRI, but it's becoming possible now as we move to larger and larger data sets. And the reality is, if the new anti-amyloid antibody drugs are given early enough, they will actually slow the progression of Alzheimer's disease. So I also want to raise the question, why aren't we doing more cancer screening? There's two big objections that are usually raised about this. The first is cost. There are some companies that sell MRI screening for cancer and other things, but it typically costs about $1,000 to $3,000. But I think there's a lot of room for innovation here to reduce the costs, and theoretically we should be able to bring this down to just a few $100s. The other objection that occurs is around false positives, and this is an objection we hear a lot from the FDA as well as doctors. So the FDA is often worried that people aren't going to be able to respond correctly to risk information, either from an AI or a doctor, and then they're going to do something drastic. There's actually very little evidence for this, but this is a concern always at the FDA. And then doctors, they're always a little bit worried about screening because if an AI suggests that a lesion may be malignant or cancerous, then they will feel obligated to do a biopsy. Because if they don't do a biopsy and the patient gets cancer, then they will be subject to legal liability and possibly lawsuits. But AI risk metrics can and should be well calibrated, which means if the AI says there's a 30% chance that a lesion is a malignant tumor, then the AI is going to be right 30% of the time. And this sort of quantified uncertainty information is always useful to know if you can use it in the right way. So the problem here is not really with the screening and the AI, it's more with how we understand, communicate, and use uncertainty. And we need to move away from the precautionary principle, which just looks at the harms, potential risks, and benefits of action, to a more broader principle that looks at both the risks and benefits of action and the risks and benefits of inaction. Sometimes it's called the bractionary principle. So in conclusion, to move from sick care to healthcare, we need AI. And I hope a lot of you will help bring in this AI future. Thank you.